And we are here to chat about different health topics. So if you are new here, the way that this works is you guys ask me health questions, put them in the chat box, and I will answer them for you. I also have a whiteboard here where I usually just pick a topic, discuss something with you, and give you some health tips. So what we'll do is we'll get started. And I do this every night. So if you are new here and you haven't joined us before, welcome and feel free to ask me health questions. Okay, so let's see what we can talk about. I know a lot of you like talking about different health things. A lot of people question me about gut health stuff. So I was thinking of talking about H. pylori disease this evening. So let's talk about that. So H. pylori. So basically, what H. pylori is, it's a bacterial overgrowth in the stomach. So it's a bacteria in the stomach. Now you can have this, and you could be completely normal with it. Like you might not have any issues, but sometimes what can happen is some people are more sensitive to it. It can overgrow and it can cause issues. So a lot of times if you do experience things like stomach pain, heartburn, nausea, those are big ones. What else would you experience with H. pylori? You could also experience things like bloating. That's a very common one as well. Bad breath is another common one. Somebody had a question about this. We talked about it a couple nights ago. But yeah, that's kind of like what you would experience the main symptoms with H. pylori disease. And then this can vary from person to person on how severe these are. So that would be symptoms. If you're experiencing any of these symptoms, a lot of it would really be like that upper stomach pain, like not your lower abdomen, it would be in the upper area. If you do experience that, you might want to get H. pylori checked out. So, okay. So, if anybody's just joining us, welcome. This is Let's Talk Health Live. I'm Dr. Amanda, naturopathic doctor. Here is our live health Q&A. So you guys ask me your questions, put them in the comment box, and then I will get back to you and answer the questions on this live stream. Tonight we're talking about H. pylori disease, but your questions can be in regards to anything. So if you do have a question, just feel free to drop it in the comments. Okay. And then these lives do get posted after, so I'm going to erase this for now, and we'll continue talking about H. pylori, so you can always go back and look at this. Okay, so H. pylori, bacteria in the stomach. So how do we test, or how do we figure out if you have H. pylori? So if you have some of those symptoms, you're having pain, the bloating, the acid reflux, heartburn, nausea, then you might say, okay, maybe we should get H. pylori tested. So there's different ways. There's a blood test. So that would be like a blood draw, and they would test for that. There is a breath test, which is one of the better options over the blood test, doing the breath test. And then there's also doing the endoscope, doing a scope. So where they go into the mouth with the camera, go into your stomach, and then they could actually sample and see if you have it. Now that's a more invasive way. Generally you wouldn't go and do that first unless there's like something else going on as well. If you've had maybe persistent acid reflux that's not gone better, if you have other things, if you're losing weight, other signs and symptoms that might lead them to doing the scope. So that's one way of knowing. But generally the breath test is the better option to do over the blood draw, and it's a simple breath test where either positive or negative, and then you find out if you have H. pylori or not. So it's either just going to be positive or negative for both that blood and the breath test. Okay. Oh, there's also stool. Sorry, I forgot to mention that. Stool test. You can do that on a stool test as well. So the stool test can find if there is H. pylori present as well. So it could be a comprehensive stool test, or you can just single test for H. pylori. And it can also test for some of the virulence factors, which are different codes in the gene. And it could see if there's issues with that as well. So, okay, so that's H. pylori symptoms, testing, and if anybody is just joining us, this is Let's Talk Health Live. Hi and welcome. I'm Dr. Amanda, naturopathic doctor. This is our live health Q&A. So ask me your questions, drop them in the comment box. I get lots of great questions from you guys. We talked about supplements, diets, different trendy diets. We had great questions about skin health and hormone health. So if you have any questions, even if it's not pertaining to tonight's topic, just drop them in the chat and I'll answer it. And if you are new here, be sure to subscribe and like and join our health community because I go live every night.
Is it possible to change our skin color from like brown to light brown with any products or home remedies, etc.?
So some like topical treatments could lighten skin a little bit, but you would have to be like applying it over your whole body. So sometimes even just like a retinol can lighten the skin a little bit, benzoyl peroxide, like things that are kind of used for acne, because they're kind of working on like that pigmentation, right? So the acne pigmentation, and can just lighten it. But it's not something that's recommended to lighten overall skin. There is glutathione that can be done through IV. That is more so to help with like brightening the skin. There's not really research on it that says that it will change your skin tone to lighter, but it can help with more so with brightening the skin. So maybe in that case, it might look a little bit lighter. But that's what I would say for that. If we're looking at like dark spots under the eye. Specifically, sometimes there's like products that contain caffeine that can help with that. There's products that contain vitamin C that can help with brightening up, but I wouldn't say you can directly like lighten your skin. Good question.
How to get rid of bad smell underarm?
Okay, so underarm smell. So you want to look at a couple things there and see what's going on hormonally, because sometimes imbalance in hormones can cause that, and then depending on, let's say, different stages of, if you are a female, like in having your menstrual cycle, your fluctuation of your hormones can impact that as well. So that would be one thing I would look into, like seeing your hormone levels. So that would be things like estrogen, testosterone, DHEA, and for sure cortisol. There can be stress sweat that happens, and then that can be contributing to a stronger smell. So that's one thing I would look at. The other one is even just looking at general hygiene and seeing what the products that you're using, are they not working for you in terms of deodorant or body wash, and how often you're doing that, because sometimes there could even just be a product that doesn't work well for your body or your pH of your skin. Everybody's skin is so different. So those are two things I would look into. Once you've kind of like looked into that, then just also looking into things like diet. So diet can actually, like what you eat can sometimes come out in the pores. So if you're eating a lot of things like garlic, onions, very strong, pungent spices, that can sometimes also cause that. So there wouldn't be a direct supplement for that. I would say trying to figure out what is going on. If it is a hormonal imbalance, and you might need to target that. So if it's like high cortisol, taking something like ashwagandha or lemon balm to help calm your cortisol down. If it is the foods that you're eating, adjusting your diet. If it's more hygiene, trying out different products. But I hope that was helpful. If you have a follow-up question to that, let me know in the comment box. If you did find that helpful, please sure to like this video and also subscribe and join our community. Okay, thanks guys for the questions.
Is Vaseline good for our lips? Can it reduce the cracks?
Yeah, it is. It is hydrating. So Vaseline, general lip chap. What else? Like coconut oil can even be used as well. Something like Vaseline is more so if you have really bad chapped lips and you wanted something that's much stronger. But just something that would be more of like a natural base would be something like a coconut oil based lip chap or lip balm or something like that. Okay. All right. So if anybody's just hopping on and joining us, thanks everybody for the questions so far. And this is Let's Talk Health Live. I am Dr. Amanda. I'm a naturopathic doctor, and I host this live Q&A where you guys ask me your health questions and then I give you answers. It is not medical advice, just general health information. And of course, if you have not subscribed, please do and turn on notifications and okay. Yes, I appreciate all the subscribes and the likes and the contributing to the community here, so thank you. Sorry, I'm trying here. Okay. H. pylori, we talked about, if you were just joining us, we were talking about the symptoms of H. pylori and then how to test for it. So why don't we talk a little bit about treatment, like what can be done to treat H. pylori. And if anybody has other questions in the meantime, just drop them in the comment box. Okay, so there's a couple ways you can go about this. You could do antibiotics. And that's usually it's like a combination of antibiotics plus a PPI, which is to help with acid, and then there may be something else thrown in there, like Pepto-Bismol or something like that. Now, as I mentioned, I am a naturopathic doctor and I do take a holistic approach, but I have had H. pylori cases where I have prescribed antibiotics or and like the 3 or 4 triple therapy. And that is because there were very resistant cases of H. pylori, or maybe that was more so patient preference. We always kind of have to take that into consideration, benefits versus risks. But if I am ever doing antibiotic or any sort of medication therapy, I always want to make sure I'm still going to use some sort of herbs or probiotics and stuff to still help prevent the H. pylori overgrowth and support the microbiome. So it's not bad if you do go that route. But I would say if you go that route, you want to make sure to do the probiotics with it. Okay, so that's one way. Or you can do herbals. And there's so many great herbs that can help with H. pylori overgrowth. So you'd want to do herbals, and then you want to also do the probiotics. And then also diet. So typically a low salt diet can help with this, so lower salt. Green tea is really good. And flax oil has also been really helpful. So those are just some things to think about. Probiotic, I would say do a multi-strain. So that just means a general blend of different ones. Herbals, there's so many different things, like berberine can help. What else is there? Mastic gum. Those are kind of two ones that can help out with that. But yeah, there's so many things that can help out with H. pylori. the main thing is you want to target that bacterial overgrowth and then make sure you're supporting the microbiome with probiotics. So that's what I would say. Kind of a blend of, if you wanted to do a blend of antibiotics with this, you can definitely do that. If you want to just do this stuff, you can do that, but I wouldn't just do this one on its own. It will just imbalance your microbiome, and then that can lead to an issue. Okay, so if anybody's just joining us, welcome. This is Let's Talk Health Live. I'm Dr. Amanda. This is our live health Q&A where we provide you with health tips, and you guys ask me any health questions that you might have. So if you are new here, please do subscribe, turn on notifications. I go live every night, so in case you don't have a question tonight, maybe the next time you're joining me, if you have those notifications turned on, you'll be able to hop on and ask me a question. So thank you so much. I appreciate your likes.
Is using mobile harmful for our eyes? How much is efficient?
A mobile phone? Yeah, so definitely the technology that we were using so much more technology than we used to before. So using your phone, using a computer, anything that's up close, it can actually impact your vision. So the reason being is because when we have things close to us, we're just using our like close up vision, whereas like opposed to like when we look far in the distance, and then our eyes have to focus on things far and focus on that. So what I usually recommend is if you're somebody that works at a computer or is on your phone often, every 30 minutes you want to take a break from looking at your phone, and you want to look about try to look out your window somewhere far, not just like at your wall, but try to look out a window, or let's say you're in an office, like looking across the office building, at least like 100 feet, and then look out there for a good like 10 to 30 seconds, just to let your eyes adjust to the distance. That can help with protecting your eyes, because it is true that looking at things close up can damage your vision, or how well your vision works. In terms of things that can support eye health, just in general, antioxidants, so vitamin C, vitamin E are really good for that. Lutein is a specific antioxidant, and zeaxanthin. So those two, you'll typically find them in eye support formulas. So that's just something that can help with general eye health. But yeah, thanks for your question. If you have a follow-up question, let me know. I hope that was helpful. If it was, please give this video a like, and of course join our community here.
Hello, doctor. I rarely have solid excrement. What do you recommend for food?
Sir, can you repeat the question?
Hello, doctor. I rarely have solid excrement.
Okay, yeah.
What do you recommend for food?
Okay, so you're not having solid bowel movements, you're having more so looser stools, it sounds like, more of the diarrhea type. We did do a live not too long ago about diarrhea, so you might want to check that one out. But what I would say is there could be a combination of things going on. Perhaps it is something in your diet that might be contributing to it. So doing an elimination diet can be very beneficial. So that's where you eliminate foods, see how your body does, and then slowly add them back in and see if you've had a trigger from those foods. Common things that can cause looser stools are things that are higher in sugar, high in dairy as well, can sometimes cause loose stools, or even fatty foods can cause more of the floating greasier stools. So that's what I would say to try to avoid or limit. And then on the other hand is you'd want to have fiber. Now fiber is one of those things that can help with both constipation and diarrhea, it can help balance things out. So in your case, you'd want some bulking fiber, so things like ground flax, things like oats, all your lentils and legumes, that can help with supporting bulking up your stools so they're not as loose. What else would I suggest? That's the main thing I would say for your diet, making sure you're staying hydrated as well. And then in terms of other things, you can always look into probiotics too. Probiotics are great, especially for loose stools, there's this strain called Saccharomyces boulardii. That's a really good one. So that's what I would say. If you had a follow-up question to that, let me know. I hope that was helpful. If you had any other questions about your bowel movements, just feel free to drop them in the comments. And if you are new to our channel, be sure to subscribe and join our community here. Okay. So we covered quite a bit for H. pylori. I will leave the chat open for a couple more minutes to see if anybody has any other questions, health related, and we can kind of just like recap or for H. pylori. So what else would the other thing I would say at the end of kind of your treatment, we can also talk about different herbal teas that can help out with this. So let's talk about some teas. I did already mention green tea. There's also chamomile tea. And then ginger. Those would be my top 3 to help out with H. pylori. You got ginger, which is really good, anti-inflammatory, can also help with nausea. The green tea specifically can help with fighting the H. pylori, and then chamomile is great for any stomach pain, any digestive upset, bloating, gas, bowel issues that might be associated with it. So those teas I would say would be my top 4 helping out with H. pylori. And this is something that you could have like 1 to 2 times a day for sure. Maybe green tea in the morning because it has caffeine, but the other 2 are decaf, so you don't have to worry about that. Okay, so I think we'll wrap up then for tonight, guys. Thank you all for joining us. Thank you for subscribing and liking and being a part of our health community. Be sure to check back and turn on those notifications so you can ask me your health questions at our next live. Have a great night.